How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melindy, and this is Disruptive Dialogue. Hello, Disruptors. Chuck Melindy with Disruptive Dialogue. Hope everyone is doing well today. I'm going to start off by saying I've been drinking water the last couple of podcasts, had the 4th of July holidays, and trying to give the old liver a break. So I'm doing something a little different over the holidays, and I sent out a little blurb the other day. I'm going to go probably July and August, every other week versus every week, and I'm going to focus on Healthcare 101. And basically what I mean by that is going over insurance coverage. So a couple episodes, I'm going to talk about private insurance and what that looks like. That's a two-part series, and the first one's going to be today. Then I'm going to talk about Medicare, Medicare Advantage, Medicaid. These are all different ways to be insured in our country for healthcare. I know that it's confusing, and my goal is to simplify it a little bit for you so everybody understands it a little better than they do currently. If you're an expert in healthcare and health insurance, you might find this redundant, but hopefully many of you will find it helpful. So let's talk about private health insurance. And I did a funny thing today. I moved my summary slide to the beginning of my talk versus the end, because I want to really give everybody just an overview that, first off, look, we all know healthcare is confusing. Trying to compare plans, what am I eligible for, how much will it cost? It is super confusing. Just so you know, the industry, the companies that run insurance, it's designed to be that way. Secondly, the cost of insurance is becoming prohibitive. It's just really, really getting expensive. We're going to talk about what the average costs are for different factors of what you pay for insurance, but we definitely need our legislators to somehow work with these companies to lower costs. One thing I don't think we all do as well as we should is preventive care. Now, preventive care is usually fully covered. Basically, you're not having to pay anything extra for that. We're going to talk about your monthly premiums that you have to pay. Your preventive care is usually covered. And I'm talking like your checkups. I'm talking about your colonoscopies, mammograms, things like that. Think about it, and I'm going to make some comparisons to housing and cars with health insurance, but think about it like your car. You take your car and you get the tires rotated, or to get the oil changed, or to have a tune-up. You do that so that you don't have a big issue down the road that's super expensive. No different than you going in for regular checkups, regular physicals, and really and truly staying on top of that, especially because it's usually already covered with your premiums. Bottom line is, I know it's a daunting task. We all need to become better consumers of healthcare. Look, we usually wait till the end of the year, and I'm going to touch on enrollment periods, but we usually wait till the end of the year to do our research and go, okay, what works for me or my family moving forward? I mean, then we jump into it, we get overwhelmed, and we make a split decision most of the time. If you're buying a house, if you're buying a car, if you're going to rent an apartment, you take your time, you do your research, you get on the internet, you make phone calls, you compare. We need to start to do that more often. That's what this series is about, to take healthcare away from being so intimidating to realize, it's not that bad, and this is how I do it. I think if we become better consumers, I think that will help us to choose better, but also help us to lower costs overall. So the last thing I want to tell you, and we're going to walk through timelines of open enrollment, et cetera, is don't wait to the last minute. You're going to see that enrollments, like for Medicare, it's going to be in mid-October. For private insurance, starts in mid-November. Don't wait till October, November, December to start to do your research. Start to do it in August, September, October. Make phone calls. I'm going to do some work with you on ChatGPT. I think there's a lot of really cool things out there and tools that are at our fingertips, and we just need to know how to use it. So, what is private health insurance? Basically, it's insurance that is not covered by the government. So it is paid for basically and run by private companies. And you know the names of these companies: Humana, United Health Group, Aetna, Cigna, etc. Now, many of us in the U.S., especially if you're with a larger employer, you are going to have your employer who's going to have that as one part of your benefits when you go work there. And these are called employer-sponsored plans. And that's awesome. But many people don't. Many people have gig jobs. They don't work for a big employer, or they work for an employer that doesn't offer benefit plans. And so then you're going to be looking at individual plans, and you can do that directly. There's different ways to do that. You can call a health insurance broker. You can just Google that. You may go through the ACA Marketplace, the Affordable Care Act. So that's been around a long time, and it's very helpful, and we will touch on that as well. But that's where a lot of individuals will go if they don't have employer-sponsored plans. And then lastly, associations or unions can also help out there. So we're going to first start with enrollment and access. And like I said, most people, you're going to get covered through your work. I think a lot of us, when we interview and we're talking to employers, that's one of the biggest things we ask is, hey, what kind of benefits do you have? And there is open enrollment when you have an employer offering your health benefits every single year. The ACA Marketplace, as I just mentioned, is available for basically individuals without employer coverage. So what are the dates around that? So just know this, it's near the back half of the year whenever you're going to enroll. So when it comes to private insurance, November 1 to January 15, those are big dates. So November 1, basically it's called open enrollment. That's when open enrollment starts. The plans will have all their different benefit designs out there, and you can sign up for a plan starting November 1st of every year. And you usually have about 2.5 months through January 15th. Now, a couple caveats here. If you sign up before December 15, then your coverage will go into effect the first of the year. So we're in 2025. So November 1 of this year, open enrollment for private insurance is going to start. If you enroll between November 1 and December 15, your coverage kicks in on January 1. If you don't enroll prior to December 15 and you go in that last month of the enrollment period, which is December 15 to January 15, then your insurance kicks in on February 1. And you got to be careful that you're somehow covered during that month of January. You don't want to your coverage for this year ends on December 31 and you delayed getting enrolled and your insurance doesn't kick in to February 1. And in the month of January, you get in an accident. Something happens. You're not covered. You don't want to do that. So try to enroll before December 15. Some other key dates in regards to the marketplace. Like I said, open enrollment ends on January 15th, but the new law that was just passed, the OBBA, or the, whatever they call it, the big beautiful bill, that is going to shorten the enrollment period. So not this year, nothing will change, but starting next year, the enrollment period probably will end on December 15th and not January 15th. So you need to be aware of that, and you need to be ready to enroll a little bit earlier and have your ducks in a row a little sooner. So we talked about employer-sponsored plans. We all know what that is. Medicare, we're not going to talk about Medicare and Medicaid today, but Medicare has a slightly different enrollment period. Their enrollment period goes from October 15 to December 7. So if you have a parent, a grandparent, their enrollment period starts a little bit earlier than the private insurance market. Medicaid and CHIP. CHIP is the Children's Health Insurance Program. That can vary as well. State-based marketplace insurance programs can vary, and then there are some special enrollment periods. These are things that you can Google online anytime according to what you're going to deal with. So what are the costs? We talked about enrollment periods. What are the costs that have to do with health insurance? Well, there's a bunch, and I don't want you to get overwhelmed, but we're going to walk through each one of them. I'm going to give you a top line what it is, and then I'm really going to dig deep. So premiums are something that you will pay every month. So think of it almost like if you're renting an apartment, okay? you have to pay rent every month. You don't own the apartment. It gives you the right to live there. Same with a premium. You have insurance and it gives you the right to use that insurance if you pay a certain amount every month throughout the year. That doesn't include any services. It just means, oh, I have insurance, and then how much you pay, how much the insurer pays after that is going to be based on your benefit design. So just know your premiums, you're going to pay once a month. It's like a lease. There's a deductible. Now, think about a deductible similar to, like, let's say a deposit. If you have an apartment, you have a deposit, so you have to put money up front. A deductible is very similar. So you, just like rent, you're paying your premium every month, and now you're going to go and get a service, go see the doctor, you cut your hand, whatever, you go to the clinic. You're going to have to pay your deductible, and your deductible basically is an amount that you pay out of pocket before the insurance company starts to pay for services. So right away, you're paying a set amount every month, and you're paying a fixed amount, which will be defined at the beginning of the year, which is called your deductible. After your deductible is met, once you've paid it, and it can vary, it could be a high deductible health plan, it could be a couple $1,000s. If it's not a high deductible health plan, it's a lower deductible, maybe it's $200, $500. It's going to vary on the benefit design you choose, but you're going to have a copay. And a copay basically means that for a specific type of service, you're going to pay a certain amount of money. It may be, for example, you're going to go to a doctor's office. Your copay at the doctor's office is $30. Or you're going to go fill a prescription, and your copay for the prescription is $10. Now there's a thing called coinsurance. So copay is a fixed dollar amount. Coinsurance is not. It is a percentage. So it could be a 5% coinsurance, 10, 20%. As you can imagine, the cost of the product or the service that you're going to get is going to have a huge impact on how much that is. If you're paying 20% of, $50, that's $10. If you're paying 20% of $1,000, you're talking $200. So that's very important. Thing called out-of-pocket max or out-of-pocket maximum. And what that basically means is that's the most that a patient has to pay out of pocket every year. Now, this does not include your premiums. Your premiums are just, like I said, it's like your rent. So that doesn't matter. What you pay for your deductible and your coinsurance and your copays, that will hit a certain threshold. And if you use a lot of products or services that year, you may hit your out-of-pocket max. And once you hit that, then the insurance company pays for everything. So know that that is there. There are other things that will impact how much you pay, like network restrictions, which basically means you have in-network physicians and or facilities like a hospital, or you have out-of-network. And most plans will say, if you're in-network, which they probably have a contract with those physicians or those facilities, then your copay or your coinsurance is going to be less. If you're out of network, which means they probably don't have a contract with that physician or that hospital, you're going to pay more. So when you go to look for your insurance, if you have a specific doctor or a specific facility, a hospital, whatever, that you want to make sure you go to, you need to make sure that that doctor or that facility is in network. If they're out of network, either you're not going to go see them or it's going to cost extra. And then there's this whole prescription drug pricing, and we're not going to get into that today. We've talked about drug pricing and things like that. But once again, that is going to impact what you do. So let's talk about the one thing that hits everybody, no matter what, if you have insurance, and that is premiums. As we already said, premiums are your monthly payment that you make to the insurance company, whether you use healthcare or not. It's the average annual health insurance premiums in 2024 for an individual was just under $9,000. So think about that. The average premium for 2024 for one person was around $9,000. Now, you would divide that by 12, so that's around, $750 a month. So a lot of money, and that's the average. That was an increase last year of 6%. The average annual premium for a family of 4 last year was $25,000, Do the math. That's about $2,100 a month. That's the average. And that also increased 7% in 2024. What's crazy is premiums for a family of 4 have increased 52% since 2014. So premiums are a huge deal. And the one thing to know about when you are going to go look at your premiums is there are a number of things that impact how much you pay. This is where you need to do your homework. Things like how old you are. That's going to impact. If you're 85, it's going to cost more than if you're 21, obviously, because you're going to have more health issues. Something a lot of people don't know, where you live is a huge deal. And we're going to get into that a little bit. The type of plan or the type of benefit design you choose will also impact how much you pay in your premium. Now, there are, for some individuals, especially with the marketplace, so not really with health insurance through your employer, but through the ACA marketplace, there are subsidiaries and other tax credits, et cetera, that you can use that can help offset the cost of premiums for people with lower income. And then a few other factors that can play into this is what's your health status? Do you have chronic illnesses? They will know that. Do you use tobacco? You've been asked these questions at the doctor's office. All these things will make a difference in how much you pay every month for your health insurance premiums. So let's talk about where you live. So factors that come into play, at the end of the day, this is something that you really don't have any control over. So if you live in a city that doesn't have a lot of hospitals, if those hospitals are really expensive, your insurance just for that one or two hospitals is probably going to be higher because you don't have a lot of choices. There's not a lot of competition, and these hospitals are expensive. Also, are you in an area where there are a number of health plans? If you're in an area where there's 5, 6, 8 health plans to choose from, there's better competition. So more than likely your premiums will be lower. If there's fewer plans or carriers in that area, then your premiums might be higher. In general, sorry if you live in these places, but in general, regions like New England or the Mideast states like the East Coast, they tend to have higher healthcare costs. When I say higher healthcare costs, higher premiums than, let's say, the Rocky Mountain area or the Southwest. Certain states that are super expensive, New York, Alaska, for two different reasons. New York, high income people, just healthcare is going to be higher there. Alaska, not as much access to physicians and hospitals or health plans. Those are why those are more expensive. For some reason, Maryland, pretty cheap state for premiums when it comes to health insurance. Here's how crazy it gets, even down to the city. So metro areas, usually with high concentrations of professionals with jobs and higher income levels, you're going to see healthcare costs higher per capita than other places, hence New York. So usually when you go in to Google or whatever you want and you look, put in your zip code. That will start to tell you. You want to put in your zip code. You want to put in who your physician is, make sure they're a network, all those things. Now, another factor that hits premiums that can make them go up or down is what type of plan you choose. So, like I said, one thing to think about is many employers will offer group health insurance. And usually group health insurance, think about it, it's a larger group, so they have more leverage. An insurance company is going to have more people, so they want that business. They're going to give you a better deal than if you're an individual. So usually if you're in an employer-sponsored plan, you're going to be in either a large group or small group plan, and that's going to make a difference. Now, if you're in an employer plan and you're an individual versus a family, like I already said, you're talking about $9,000 a year versus $25,000, an individual versus a family of 4. So that's going to make a difference. Self-insured versus fully insured. You're not going to really have a choice here. That usually depends on the employer and the size of the employer. Smaller employers are fully insured. And basically what that means is they're not going to carry any risk. Whatever they or their employees use, the insurance company is going to have to pay for that. So the insurance company is going to charge more for a fully insured plan, which is usually smaller employers. Now, larger employers, usually over 50 employees or 100 employees, they will usually go with a self-insured plan. And a self-insured plan basically means that they have an insurance company that is going to handle all the administrative parts of the insurance plan, but all the money that the employees pay, that goes to the employer, and whatever healthcare costs are used by those employees, the employer is on the hook. So that is usually you're going to see lower premiums in self-insured than fully insured because your employer is taking the risk. But if it's a larger employer, that makes sense. Let's see what else is going on here. So if you don't have employer coverage, say you're, a bartender or cashier, or you work for, a small hardware store and they don't have employer insurance, you're usually going to go through exchange, the marketplace exchange. Where you go for that is healthcare.gov. Okay. So that's the website. Now, even though it is a government-run exchange, it is considered private insurance because it is handled by private carriers. So even though you go to healthcare.gov, it is still run by private payers, so it is considered private insurance. So when you go to the private exchange, basically, and we're not going to get deep in it today, but there are 4 tiers with that, and they're metals. So you have platinum is the highest tier, then you have gold, then you have silver, then you have bronze. And so as you can imagine, a platinum ACA marketplace exchange plan is going to be a little bit more expensive, but it probably is going to give you more options, let you go to wherever you want to go, but you're going to pay for that. If you're looking to pay less for your premiums, then you're going to go to a bronze plan. If you want to go somewhere in between, you have the gold and the silver plans. What's another factor that plays into whether your premiums are high or low or what that amount is? Benefit design. Benefit design significantly impacts your health insurance premiums because that is going to determine how much you pay for your healthcare costs, how much the insurance company is going to pay for their healthcare costs. So some general, and I should say more common benefit designs are an HMO, also known as a health maintenance organization. Usually an HMO gives you less choices as far as physicians and the network that you're going to go get your healthcare from as far as facilities and physicians, but your premiums are lower. So you have less flexibility, lower cost. A PPO or a preferred provider organization, you get more flexibility. You kind of get to choose where you want to go, but your premiums are higher. So you're going to pay for that choice. As in addition to your premiums being higher, your out of pocket, your copays, your coinsurance is probably going to be a little bit higher also. One other thing about an HMO is usually you're going to have a primary care physician. So your primary care physician is the one that is kind of like what they call a gatekeeper with an HMO. And basically you will go to them. They'll say, oh, here's what's going on. Let me call the cardiologist. Let me make sure you can go to that cardiologist. So you need a referral to go to a specialist. With a PPO, a little bit more expensive, but you don't need to go to your primary care physician. If you're like, oh my God, my heart's killing me or my stomach's bothering me, you can go to a cardiologist or a gastroenterologist without going to the primary care physician. So that is a little bit of a difference. High deductible health plans. This is something that is gaining more and more popularity for people who are saying, you know what, I'm not that sick. I don't use that many healthcare services and products right now. So I just want to worry about what's my monthly premium. And I want to have coverage in case I get hit by a car or I have cancer. So a high deductible health plan basically means your deductible is high. So think about it. Your premiums are your monthly payments. Your deductible in a high deductible health plan is what it is. You're going to have a high deductible. So if your deductible is higher, your premiums are usually lower. And vice versa, if your deductible is lower, your premiums are likely higher. And the reason for that is simple. You're going to pay your monthly premium, But if the insurance company isn't going to have to pay anything out for a while, so like say you're in a high deductible health plan and your deductible is $3,000, okay? Your premiums will be much lower than if your deductible is $500 because the insurance company with your high deductible health plan at $3,000 isn't going to start paying anything out till you spent $3,000. And if you're healthy, you're probably not going to spend $3,000 in a year. But if your deductible is $500, well, I don't even care if you're healthy. More than likely with checkups and different things, you're going to hit that. The insurance company is going to have to pay out sooner, so your premiums will be higher. So just remember that inverse relationship. A higher deductible, a lower premium. A lower deductible, a higher premium. If you go to YouTube or if you go to my show notes, I will have some slides there that you can look at. And I was able to pull up a really cool thing. It's a chart basically, and it looks at these different plans. Everything from, like I said, an HMO to a PPO, EPO, which is an exclusive provider organization, POS, which is point of service, your high deductible health plan with an HSA. There's tiered networks, there's value-based insurance designs. So there's a bunch of different type of benefit plans that you can use. What's nice about the chart is that it'll tell you, with the plan you choose, do you have to go to a primary care physician? Is that required to go to a specialist? Do you need a referral? Is your out-of-network coverage? So if your network is like a certain population of docs and facilities and you want to go outside of that, some plans where you pay more, you can. You can go outside of that and you're still covered. Other plans, if you're not and you go out of there, you're probably paying everything out of pocket. This all boils down to, according to these different type of plans or benefit designs, whether your premium is going to be high or low, and whether your deductible is high or low. And what's really cool that I liked about this little chart is that it will tell you who each type of plan is good for. So like for an HMO, where you have low premiums and low deductibles, it's basically best for people who want low costs and are okay with limited choice. If you said, nope, I want to have some choice, I don't want to have to go to a PCP, I don't want to have to get a referral, then I go to a preferred provider organization or PPO. You're going to pay higher premiums, your deductibles will be medium to high, and this is for people who want provider flexibility and not have to go through a referral. So you can see how there are different ways to play with this. But the bottom line is you can't do this overnight and you need to do it ahead of time. So we talked about that. I'll give you one last, chart of what benefit design is good for you. Basically, if you're young and healthy, you really want to look at a high deductible health plan that has an HSA, which is a health savings account. That will allow you to save on premiums. You can build up your HSA savings, which you can continue to build up if you don't use them. And, you don't expect to use a lot of medical care. So this is a good choice for you. If you have chronic conditions, if you have diabetes, if you have rheumatoid arthritis, you have any condition that is constantly going to have you going to the physician's office and or getting high cost medicines, you're probably going to want to go to a value-based insurance design or a PPO or a POS or point of sale. You're going to have access to specialists. It's going to be lower cost for higher value services for those type of plans. If you're budget conscious and you want predictable costs, you're probably going to go with an HMO, which is a health maintenance organization. You're going to go see your PCP or your primary care physician all the time. So there are all these different type of choices to make. Like I said, I really liked comparing health insurance to renting. You've got your monthly payment, you've got your deposit when you're in an apartment versus your deductibles. You have to pay for some things like utilities or a pet fee, just like insurance, health insurance. You're going to have your copay, your co-insurance. Sometimes you're going to have restrictions. You'll pay more for an apartment if you want to have a pet. You're going to pay more for insurance if you want to be able to go outside of network. So just know there's a give and take. Another area that we deal with, I think, more often than we do with health insurance is car insurance. Very similar once again. Just like health insurance, car insurance, you're going to pay your monthly premium whether you use the services or not. If you have an accident with your car, you're going to pay a deductible before the insurance kicks in, just like health insurance. After that, the insurance company, after your deductible, they're going to have you pay either a fixed amount or a percentage of the remaining charges, just like health insurance. So lastly, like we said, and I already used the example, go get your checkups, go get your mammograms, your colonoscopies, all of these things, just like you would your car. You go get your oil change, etc. So I'm going to leave everybody with this. Health insurance is designed to be complicated. I know that it is really challenging and intimidating. Don't let it be. The best thing you can do is to plan ahead. And I would say probably September, October is when you want to start to go, okay, next year I'm going to have health insurance. How do I like what I have right now? They'll send you so much paperwork. You'll go online. They've got so many pages online. It gets very, very overwhelming. You can call them. Most of the time you call the insurance companies, you talk to a benefit advisor, they're going to give you good advice. So with that, I hope this was helpful. We will touch on some of the other parts of private insurance in my next episode. Hopefully this was informative, and I will see you next time. Have a great day.